Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor. And this is a video about trying to determine in which order different symptoms or conditions need to be treated. This is something that's not there are no hard and fast rules around around this topic, and there are certainly no research studies indicating what the best order is in which to treat various conditions, because it would just be a nightmare trying to design a study like that. It would just probably never work in our existing model anyways of how research is conducted. And so what it ultimately comes down to is just, clinical experience, seeing what seems to work. And once again, where there are no hard and fast rules, a good general rule in my experience and in my opinion is to focus on a few different factors. One is looking at the timeline, which symptoms or issues came on first. And it's, once again, not a hard and fast rule, but oftentimes whatever came first in the timeline of the onset of various symptoms or issues is oftentimes one of the more important things to work on in terms of resolving a root cause. Now, that being said, I've had many patients where they have accumulated health issues over the course of time, and it's ultimately left them with a lot of, say, debilitating pain. And in those cases, there have been many cases in my experience where the first step is dampening down that pain so that the patient can function, has reduce overall levels of stress hormones floating around in their body, less inflammation overall. We kind of need to take the edge off of things or improve those symptoms before we'll have a good chance of really tackling the root cause aspects of things the most effectively. But in terms of actually getting into the nitty-gritty of getting the patient, on the track of being 100% well, or as close to 100% as possible, oftentimes the first things that started off in that timeline are important to look at addressing. Other questions to ask would be, which symptoms are causing the patient the most grief? So what are the biggest problems? So I've had many patients in my experience in my practice over the course of time where they'll have, say, SIBO and borreliosis, sometimes referred to as chronic Lyme disease, and Bartonella, and viral reactivations with, say, Epstein-Barr virus, and they've got mold issues, and they've got methylation issues. And they have test results indicating they have accumulated heavy metals in their system. So they've got, and maybe there's other things on top of that. Maybe there's mast cell activation syndrome and other things too. It's like some patients just seem to have every single condition checked off. And one of the questions that I ask the patient and kind of asking myself is, which symptoms seem to be the most problematic? Because if pain is the worst symptom, or fatigue is the worst symptom, or digestive issues are the worst symptom, or the incredibly scary and certainly off-putting crazy histamine reactions with random heart palpitations and panic attacks and can't catch, sort of hyperventilation and different things that can sometimes happen with more extreme manifestations of high histamine related issues. Depending on what's causing the most distress and discomfort in terms of symptoms, that also dictates what we should be working on first. And that really dovetails on what I was saying about treating pain sometimes before getting at root cause factors, because if there's a lot of stress from these crazy histamine reactions, or I have patients who have many patients over the years where they have this crazy internal body tremoring or vibrations or weird sensations kind of flowing through their bodies, and it's just really, really scary and off-putting. And all my brain scans are fine, and everybody says I'm fine, and the neurologist says I'm fine, and I've got these crazy symptoms, and it's really freaking me out that there's some crazy tumor or something that just nobody's picking up on, or whatever it is. Then sometimes that's the most important thing to work on first, because it's throwing a monkey wrench in the other aspects, elements of the patient's case. So looking at the timeline and looking at which symptoms are the most problematic are two factors that are important to look at. And then the third general category that I would look at in trying to figure out what to treat first is looking at the interrelated physiology or physiological impacts of the different things that are going on. So a good example would be if there's, say, that patient that has everything checked off on the list, all those different conditions like SIBO and Borrelia, et cetera, well, looking at things from and let's just say for argument's sake that it all just hit around the same time, so there's no timeline factor, and all the symptoms are equally bad, so there's no prioritizing factor, which that type of scenario probably never exist, but if say it did, then looking at the related physiology of all of those issues would be something to consider in terms of figuring out what to go after first. And what I've seen many times in my practice is when there's digestive tract issues with a bunch of other stuff going on, it's oftentimes the best to go after those digestive issues first. And the main rationale there is because if I'm going to work with, say, nutritional cofactors to help with histamine metabolism, or if I'm going to work with herbs to go after systemic microbes, or if I'm trying to rehabilitate the patient's mitochondria using various nutrients, and including amino acids and antioxidants and creatine and ribose and things like that, then all of those things need to get absorbed through the gut. And if the gut is an inflamed mess, then we're probably not going to have the best absorption of those various nutrients and different cofactors and whatnot. And so as such, it wouldn't really make a whole lot of sense to say to someone who's got crazy digestive issues and a lot of mitochondrial dysfunction issues and other infections and whatnot, to say, oh, let's start building up your mitochondria right out of the gate. I mean, sometimes we do that, but it might be let's maybe start with that, but also let's get your gut figured out so you can actually absorb those nutrients better. Maybe complement that with some intravenous nutrient infusions, depending on the case. And so in a similar manner, if a patient was, their test results indicated that they had lots of glyphosate in their system and they had lots of heavy metals and maybe other toxins, and we also knew that they had methylation cycle issues, well, it might not make a lot of sense to be putting them on chelation therapy before we get their methylation cycle supported, because you need to methylate in order to detoxify properly and do many, many other things properly. So there's just different elements like that where taking the physiology into account can be really, really important. So just a couple of thoughts to think about there. Every case is different, but just some food for thought about how to conceptualize or if you're a clinician, some, I guess, tips on how to maybe tackle these more complicated, convoluted cases. And if you're a patient or, family member or loved one or friend or whatever, if someone who's dealing with these issues, then just to give you a kind of a sense of what might be going on inside the noggin of the clinician that's working with that person.